Previously sold through Stryker, C2DX acquired this in 2019, the STIC pressure monitor for compartment syndrome. I'm going to go through the setup of it. So this is the device. This is a reusable device, and then you have disposable components. So you have a pre-filled saline syringe, you have an 18 gauge side-ported needle, and then you have your diaphragm chamber. So these three pieces are what will go together to be used per patient, per test. They go together like so. On the diaphragm, there's this red Luer lock N that doesn't allow any of the saline within the diaphragm to run back up into your syringe. So this is the side where you will want to throw on that syringe, about a turn and a half on until it's tight. And you just want to make sure your wings of your syringe are flat to the ground so they can close within the device. And then the 18 gauge side port needle, I recommend the bevel of the needle facing the ground, facing down, and now it's fully set up. And then you'll want to turn your device on, and on your little pressure reading display, you should see a number between -8 and +9. If you see a number outside of that, that is the device running a self-diagnostic test. So if it's 12, 15, -10, -12, it's basically going to give you an error when you go to hit 0. It's not going to be able to get to 0. So you want to make sure you're within that range. So if you turn it on, you see -6, you see 5, you're completely fine to continue the setup. So you'll want to open up your housing cover, and probably one of the more important pieces to this setup is flushing out your saline or preparing your needle when it's inside of the device. I think it's pretty standard to prep a needle, flush out fluid, and then go on for use. Here you want to put this in with the diaphragm dry and unused. That your cover will snap shut, and then it's just a flush of the fluid. Hold it up about a 45-degree angle, and you'll slowly flush the fluid through while seeing the diaphragm fill up without any air bubbles. Get a few drops out, and now it's ready to use. Once you identify where you're going to stick, if it's the anterior compartment and you think it's maybe around a 45-degree angle, right before you poke is when you would want to hit the 0 button, so it's at 0 as soon as you're about to go into the compartment. So just for an example, if you're this close to the compartment about to poke, you should feel a poke, one through the skin, one through the fascia. Then it would be a 3/10 cc push of the saline. And again, the only reason for that is to keep a fluid water column between the interstitial fluid and the fluid within your diaphragm so we can equilibrate. So you don't want any air bubbles, you don't want any skin or tissue that's in the way of the bevel of your needle. If you have to do another test, or you have to do the lateral compartment, the deep superficial, just anytime you take it out and go back in, the only steps to redo would be just re-0 if you change your angle, and then the 3/10 cc push of saline again. There's 4 compartments in the lower leg: the anterior, the lateral, the deep posterior, the superficial posterior. The most common is definitely the anterior compartment. If you have a tibial fracture, you're probably going to start with the anterior, but you can also check all 4. A good way to kind of find your landmarks and understand where to go would be starting at the patella and kind of your midline and going about a 1/3 down the midline. And then it's typically for anterior and for lateral, you're about 1 to 2 centimeters laterally on your leg. So once you have your setup and everything is correct in the monitor, then once you're ready to poke, again, you want to hit 0 directly before you poke, so right before you go on the skin. And if I'm going into the anterior compartment, I would probably go right here. Same with all 4 compartments. Everything depends on the injury and what happened and where it is. Along with adding a 20 gauge needle for a less invasive approach, QR coding to make instructions very seamless and easily accessible, we've just added a team around this product to support it moving forward. So over the last 3 years, we've grown our team, and we're here dedicated to this device to help with questions, help with training, and to ensure all of your products are ready to use in the hospital at all times.